Well, as far as DOH is concerned, and I suppose OCTA Research is concerned, mukhang pababa na tayo sa Metro Manila. Pero nationwide ba? Are we seeing that? Or may possibility pa na magka-glitch?
Well, I will take that question. And mukhang naka-black and white kami ni Father. He's the bishop and I'm the pawn. But anyway, yung trend is really downwards. We can be assured kasi for a while there were some talks now maybe we're not seeing the actual trend baka because of the testing, but the testing hasn't really decreased. We're still testing about the same level in the NCR, and we're now down to high risk, and I think within a few days by next week we'll be down to moderate risk. In fact, I checked some of the local government data, and we already have 5 LGUs under moderate risk already, and that's a good sign because it means they're ahead of the pack. I mean, they're improving faster, and these LGUs include Manila, Malabon, Caloocan, Valenzuela, and Navotas. Interestingly, 4 of them, they're from District 3 and District 1. District 1 is Manila, and District 3 would be the other 4. And so they're already under moderate risk. The rest of the NCR is still at high risk, but that will be improving soon. Pero regarding your other question, Ed, yes, it's going to be still increasing in some provinces outside NCR+. In NCR+, it's already decreasing. Yeah. Even in Cavite, Rizal, and Bulacan, we're starting to see a decrease, but it's still high in many other parts of the country. So although yung projection namin by Feb 14, by Valentine's, we could be at, maybe possibly at low risk already sa NCR, which would be good news, of course. Rest of the country will have to follow kasi the surge started later in the other parts of the country.
Pero Professor, sabi ni Yusek Barrera, up to 40% daw nung numbers affected nung antigen testing na hindi nare-report. What's the impact on your projections? Ganun kalaki, medyo malaki yun. That's 40% cases unreported.
Well, I mean, ever since the numbers are what we see will be lower than the actual numbers. Right now, there's more antigen testing being done. There are some asymptomatics who don't test. There are some or they just isolate, they don't test. And then there are some who self-test. They buy the antigen test kits and then they test at home. Pero what we look at is the trend. And in fact, yung estimate namin, it could be about 10 times higher on average than what we're seeing. I mean, that was probably during the peak. Once it goes down, the actual numbers will probably be closer to what we are seeing. And why are we confident about the trend? Because not just the numbers going down, but the positivity rate is down to 24%. Actually, I think it's down to 23% as of today, from a high of 50%. So yung positivity rate is a form of sampling, statistical sampling. And if you see a decreasing positivity rate, that means the trend is actually decreasing. And not only that, we're also seeing a decrease in hospital utilization. It's now down below 50% for ICUs and for hospital beds.
As far as the NCR is concerned, medyo, I guess we're already past we're already past that point of that worry point. But all the other regions where you have vaccination rates at what 10%, 20%, and all that, what are the chances, or is that already past na rin? What are the chances that we could have an unmanageable spike in the provinces that would reverse everything all over again?
What do you mean by that? It's unlikely that Omicron will return to the capital to initiate a surge. There's no more wood to burn. With regards to the provinces, there is a concern, and it's going to be region by region, depending upon the level of vaccination and the health capacity, how the impact of the Omicron surge will be on our kababayans there.
Yes, Father.
So
what
we
I meant
have
is,
to wait for the surge to peak in these places. Once we are post-peak, we will have a sense of whether things are getting better. But I still pray for those other regions. It's still going to be challenging for some.
Yes, Father. What I mean is, kasi, for example, the NCR, we're already good with NCR, but you're only looking at 13 to 14 million people. The rest of the country, you're looking at, 90 plus, 95 million people. So, of course, the countryside far outnumbers Metro Manila. That's my perspective. What are the chances that Omicron could still spiral out of control in the rest of the country?
I mean, is there a chance that a particular region will be overwhelmed? Certainly. If the vaccination rate is low and the hospital capacity is low and the infection explodes, then they will have challenges to their healthcare system, even with mild cases. But it's hard to predict exactly where and if this will happen, only because it's a region by region situation.